The current paradox we are dealing with in India as far as food and nutrition security is concerned is that despite economic growth in the last decade and self-sufficiency in food production, malnutrition persists. The statistics available are appalling and unacceptable. 48% of India's children are stunted, and 1/3 of all adult women are underweight. 1 in every 3 malnourished children in the world live in India. The biggest challenge for the government of India is to improve access to adequate and nutritious food for the poor, and also improve investment in nutritional-related activities like investment in health, water, and sanitation. We are talking about freeing children from a childhood of want, as it has been described by some of the writers of food insecurity in India. It is a right of the child to grow, survive, and live. This is basically what we're talking about. The government of India needs to put in place programs that holistically address the issue of access to food, provision of adequate health services, water, and sanitation. There is also the need to strengthen systems to collect and analyze data on nutrition indicators. This is critical to understand the dimension of the problem and also work on sensitive indicators to address it. It is also very critical to prioritize the nutrition agenda in government social safety net programs, while also working on improving targeting and efficiency implementation of these programs. The government has taken a bold step in passing the National Food Security Act. It is an ambitious undertaking that is required in the fight against malnutrition, and it will require the government to undertake major structural changes at the implementation level, at the state, district, and the panchayat level. It has to be an integrated effort. It will also require a change in attitude, and it also requires an investment. The children of India deserve this, and it is their right. The country itself is self-sufficient in food, but most of the programs that are in place need to be strengthened. One of the primary programs that has been used by the government to provide access to food is the targeted public distribution system. This is also the main pillar of the National Food Security Act, through which the government intends to provide access to over 813 million Indians. For this to happen, there are several improvements that are urgently required. 1, identification of the right beneficiaries. The government, the state, and the district needs to work on reducing the inclusion and exclusion errors that are currently persistent in most social safety net programs. 2, there is an urgent need to improve efficiency and accountability of social safety net programs, like the targeted public distribution system. Everybody is aware of the huge leakage that has been associated with these schemes. The Justice Wadhwa report was quite clear on the leakages in the supply chain. So it is really critical at this point in time to address these leakages and also try to work on systems that can be used to improve on the efficiency and effectiveness. The third, and not the least, is to improve the nutrition of the targeted public distribution food basket. This is critical because the food needs of children, infants, are different from the food needs of adults. We have to correct this, and it needs to be done so that the children can also benefit. The World Food Programme is the largest humanitarian organization in the fight against hunger in the world. The World Food Programme is also committed to the Secretary General's Zero Hunger campaign, which is designed to ensure that every woman, man, and child has access to adequate and nutritious food. For the World Food Programme to have any impact, there must be an impact in India, and that is why we are here. The World Food Programme has a wealth of experience working in over 80 countries, And we are here to ensure that our best practices from South-South cooperation are also brought to the people of India as they work towards improving social safety nets. It is also important at this point that we as WFP have to be with the people of India in this fight. We are now in the process of changing our approach in India. We are seeing ourselves more as a catalytic partner to support the government in strengthening the social safety nets. We are moving away from service delivery more into technical assistance and capacity development to help the government design and implement appropriate programs that we address hunger and food insecurity in India. We have worked extensively on the issue of on the intergenerational problem of malnutrition. And the World Food Programme strongly believes that a holistic approach is required in order to address the issue of malnutrition. There is need to ensure adequate access to nutritious food. There's need for investment in health, water, and sanitation. But we also strongly believe for the government of India to have impact in addressing malnutrition, there is need for a public-private sector partnership. And the World Food Programme has got experience in these areas that they will be willing to share with the government of India. The National Food Security Act is timely, and the World Food Programme is dedicated to support the government of India to improve efficiency and effectiveness of programs in the Act.